Welcome to Live a Fall-Free Life, a presentation to assist in preventing falls. This resource can be used to educate clients and caregivers on creating a safe environment and more healthy lifestyle. Our names are Lauren Briggs, Ashley Boehm, Paige Marecic, Sydney Toth, and Olivia Maust. We are students from Chatham University in the Doctor of Occupational Therapy program. Now for some facts about falls from the American Occupational Therapy Association and Centers for Disease Control and Prevention. Falls are the leading cause of injury and death among older adults. In the US alone, about 1 in 4 adults above the age of 65 and older report falling each year. That equals about 36 million falls every year. Each year, 3 million older adults are treated in emergency departments for fall injuries, and falls can cause broken bones, fractures, and traumatic brain injuries. They can also create a fear of falling again, which can lead to a decrease of movement and occupational engagement.
This slide discusses tips and tricks to help prevent falls. The organization of your living space to work for you will help to keep you safe. First, consider removing clutter from walkways. Second, consider removing or securing hazards such as throw rugs. Consider implementing safety precautions such as grab bars, handrails, and raised toilet seats in your bathroom. Don't stand on a chair, but rather stand on a sturdy stool with a handrail, or ask a family member or caregiver for help. Finally, do not use towel bars or the edges of sinks for support, as they could come off the wall. On this slide are more tips so you won't trip. Increase lighting throughout your living space so that you can see any fall risk. This might include adding lamps to dimly lit areas or getting brighter bulbs to illuminate common areas like living rooms and hallways. Watch for pets. Fall hazards might include pets. If you have a cat, dog, or other animal that freely roams around your house, try to be aware of their location and, if possible, train them not to jump on you as you walk throughout your home. Use a rubber-backed shower mat to prevent the bathroom floor from getting wet. One of the greatest hazards, as we have mentioned, can be rugs. In the bathroom, using a rubber-backed shower mat will help prevent your bathroom floor from becoming wet, which will lead to you slipping. When not in use, you may hang the rug over the side of the shower or bathtub so that it is out of your way. On this slide, we will discuss things you can do to decrease your fall risk other than making your home a safe place. First, stay physically active to keep up your strength and endurance. Next, know your limitations. If you cannot easily reach something or complete a task, wait and ask for help from a caregiver or family member. And finally, be aware of the side effects to medications that you are taking. Talk with a doctor or a pharmacist to see if any medications you are taking will put you at risk for things like dizziness, loss of coordination, or balance issues. As previously mentioned, staying physically active will help to decrease your risk of falling. On this slide, you will see pictures of different exercises that you can do to help increase your strength and endurance. Remember, if you feel unsafe or unsteady during any of these exercises, remain calm and take a break. The first exercise is called chair leg raises. Seated in a sturdy chair, hold on to the bottom of the chair with both hands. Extend one leg straight out and bring your knee in towards your chest without moving your upper body. Extend the leg back out and lower your foot to the ground. Repeat on the other side. The next activity is heel raises. Standing behind a chair, hold the back of the chair with both hands. Position your feet hip width apart. Lift up your heels and hold for 5 seconds. Lower heels back to the ground and repeat 5 more times. The next exercise is called sit to stand. Seated in an armed chair, push your butt up off the chair using both your arms and your legs. Slowly lower yourself back down into the chair in a seated position. Complete this exercise 3 times daily. The final one is leg side raises. Standing behind a chair, hold the back of the chair with both hands. Stand on one leg while raising the other leg sideways. Repeat with opposite leg.
In this slide, I have attached the link to an important resource called a home fall prevention checklist for older adults. It is a useful resource to be able to go through different rooms of the house to make sure that your home is the safest environment for you or a loved one. I'm going to be going through each section so you can follow along by clicking on the link attached to this slide. Each year, thousands of older Americans fall at home. Many of them are seriously injured and some are disabled. In 2011, nearly 23,000 people over the age of 65 died and 2.4 million were treated in emergency departments because of falls. Falls are often due to hazards and are easy to overlook, but also easy to fix. This checklist will help you find and fix those hazards in your home. The checklist asks about hazards found in each room of your home, and for each hazard, the checklist tells you how you can fix the problem. At the end of the checklist, you'll find other tips for preventing falls. First, we will begin with the floors in each room of the home. When you walk through the room, do you have to walk around furniture? If so, ask someone to move the furniture so that your path is more clear and safe. Do you have throw rugs on the floor? Remove the rugs, or you can use double-sided tape or a non-slip backing so that the rugs don't slip. Are there papers, books, towels, shoes, magazines, boxes, blankets, or other objects on the floor? Pick up the things that are cluttered on the floor so that you can keep the pathways safe and clear. Do you have to walk over wires or cords, like a lamp, telephone, or extension cord? Coil or tape cords and wires next to the wall so that you can't trip over them. If needed, have an electrician put in another outlet. Next, we will move on to the stairs and steps of your home. I want you to look at the stairs that you use both inside and outside of your home. Are there papers, shoes, books, or other objects on the stairs? Pick up things on the stairs and always keep objects off the stairs. Are some steps broken or uneven? Fix loose or uneven steps. Are you missing a light over the stairway? Lighting is important to keep stairways safe and clear. So if you can, have an electrician put an overhead light at the top or the bottom of the stairs. Do you only have one light switch for your stairs? If so, putting a light switch at the top and the bottom of the stairs will be helpful in case you are going up or down the stairs. Has the stairway light bulb burned out? Have a friend or family member change the light bulb. Is the carpet on the steps loose or torn if you have carpet on your steps? If so, make sure that the carpet is firmly attached to every step, or remove the carpet and attach non-slip rubber treads to the stairs. Lastly, are the handrails loose or broken? Or is there a handrail on only one side of the stairs? If so, fix loose handrails or put in new ones. And try to make sure that there are handrails on both sides of the stairs and that they are as long as the stairs themselves. Next, we will move into the kitchen. Looking at your kitchen and eating area, are the things you use often on high shelves? If so, move these items into your cabinets and keep things that you often use on the lower shelves rather than the higher shelves. If you have a step stool in your kitchen, try to get one with a bar to hold on to. Never use a chair as a step stool. Next, we will move to the bathrooms of the home. Is the tub or shower floor slippery? If so, put a non-slip rubber mat or self-stick strips on the floor of the tub or shower. Next, do you need some support when you get in and out of the tub, from the toilet or from the bathroom itself? If so, have grab bars put into your bathroom and put them next to the tub or inside the tub. You can also buy a shower bench or a tub bench to make transferring in and out of the shower or tub safer. Next, we will move to the bedrooms. Is the light near the bed hard to reach? If so, place a lamp close to the bed where it's easy to reach. Is the path from your bed to the bathroom dark? Put in a night light or a motion sensor light so that you can see where you're walking. Some other tricks that we will go through. Like we have stated earlier in this presentation, there are exercises that improve your balance and make your legs stronger. Exercise also helps you feel better and more confident. Have your doctor or pharmacist look at all the medicines that you take. Some medicines can make you sleepy or dizzy. Have your eyes checked by an eye doctor at least once a year and make sure that your glasses and prescriptions are updated. Get up slowly after you sit or lie down. Wear shoes both inside and outside the house. Avoid walking barefoot or wearing slippers. Improve the lighting in your home. Put in brighter light bulbs, and fluorescent light bulbs are typically brighter and they cost less to use. It's safest to have uniform lighting in a room. Add lighting to dark areas like hallways and stairwells. Hang lightweight curtains or shades to reduce glare. Paint a contrasting color on the top of the edge of all the steps so that you can see the stairs better. For example, use a light color paint on dark wood. Keep emergency numbers in large print near each phone. Put a phone near the floor in case that you do fall and can't get up. Lastly, think about wearing an alarm device around your neck that will help you in case you fall and can't get up. This concludes the safety checklist.
One option for elders to better increase safety within their space is the CAPABLE program. The CAPABLE program stands for the Community Aging in Place, Advancing Better Living for Elders. This program is a 5-month home visit program that was put in place to help seniors of low income to age in place. This program is currently in place and is used within 35 sites across the country, which includes 8 rural communities. These rural communities are located in Hawaii, Alaska, Maine, Minnesota, Pennsylvania, and Texas. The program lasts for 5 months, and each participant is able to work with a registered nurse, an occupational therapist, and a home repair service. The home repair service has a budget of $1,300 per patient to make repairs and install anything needed for safety features throughout the individual's home. The registered nurse will meet with the individual 3 to 4 times, and the occupational therapist will visit 4 to 6 times. The program is driven by client motivation. With this, the therapist and nurse do not decide what the client will be doing, but rather will use motivational interviewing so that the client can make their own goals. The home technicians will install anything that the client and therapist seem fitting for the task that the client would like to improve on. Occupational therapy's role in fall prevention. Occupational therapists can use educational resources with the clients and caregivers to help better prepare or prevent falls within the home of the individual. Basic home modifications can also be reviewed with the client to ensure the most safety for the client. Therapists can do this by implementing changes throughout the client's space that are discussed and agreed upon. Therapists may also complete an evaluation of the individual during the first session with the client. This evaluation will give the therapist an overview of their strengths, weaknesses, typical occupations, and barriers to these occupations. These can be areas such as lower body weakness, balance deficits, urinary incontinence, fear of falling, and cognitive impairment. With an evaluation of the client and modification of their environment and daily occupational tasks, the therapist can therefore help the client maintain their valued roles and safety as possible.
Walking with added equipment can be very difficult or even unsafe if it is not done properly. This slide will tell you how to be safe with your medical equipment. Avoid adding overfilled or very heavy pouches to the sides of your walker to avoid tipping. While there are tons of accessories like bags, baskets, and trays to add to your walker, they may not always be the best and safest choice for you as an individual. When it comes to using portable oxygen, if you do not use a walker, cane, or crutches, hold your oxygen tubing in your non-dominant hand while walking. If you do use a walker, cane, or crutches, loop the oxygen tubing around your ring finger and pay more attention to it as you go about your daily activities. Placing a bright, colorful tape every foot or so on the tubing can help make it more visible when it is on the floor or around you. Avoid allowing your tubing from IV poles or catheters to drag on the floor. When wanting to make adjustments to the durable medical equipment you are walking with, whether it is changing the equipment, adding accessories, adjusting the height, or anything related, it is important to consult your physical therapist, as they are the professional who decides what type of ambulating device is best for the individual's needs. While our focus is preventing falls at all costs and in any way we can, it is extremely important to learn and know what to do and how to react if you find yourself in this situation, whether or not someone is there to help you. Share this information with your friends and family to ensure that you are as safe as possible after a fall, should it happen, and how to get the help you need as soon as possible. Now we will share a video about how to recover from a fall should it happen to you or a loved one.
Hi, this is Doug Schrift with Elder Gym. Last week, I got an email from a reader who said, how do I get up off the floor after I've fallen? So this week's video tip, I'd like to show you how to do that. Okay, here we are in the bedroom, and you trip getting out of bed, going to the bathroom, and you take a fall onto the floor. So down we go onto the floor. Now, at this point, you definitely want to call out and see if somebody can come to help you. If there's nobody in the house and you don't have your cell phone, you're going to have to get off the floor. So here we are on the floor. Generally, you're on your back. So to get off your back, we need to roll onto our tummy, and that will allow us to stand up. So to roll, the first thing we're going to do is bend our knees like that. Good. Now, once our knees are bent, we're going to pick a direction to roll in. So I'm going to pick left. So what I want you to do is to interlace your fingers together and pretend you're a batter, and we're going to hit a home run to the left. So we're going to wind up and strike that ball. Over we go to the side. Yay, we made it. So now we're on our side. Now it should be really easy to roll onto our tummy. So what you're going to do is just straighten out your knees and just continue rolling over to your tummy. Now, once you're on your tummy, hopefully you'll be on your elbows. So we want to pick a strong leg. So I'm right-handed, so we'll pick my right leg. And what I want to do is bring that strong leg, try to get it underneath your torso, and then that will allow you to bring your left foot underneath your torso. Now, as you can see, I'm on my elbows and knees. Next, we want to push up onto our hands and knees. And once we get onto our hands or knees, it's really easy to get up. So we need to find a chair or a table. We'll head over to this chair. Put your hands right on the chair. And again, we want to pick the strong leg. Bring that strong leg underneath your body. Try to get your other leg up there too. Turn around and sit right down, and you made it. So just take your time, see how you feel. Hopefully there's nothing broken and you're doing okay. Take a breath, and when you're ready, you can stand up, go to the kitchen, get some water, and call your family and make sure everything's okay. That's how you get up off of the floor after you've fallen down. This is Doug Schrift. Please like this video if you like it, and there's a subscribe button. Press that, it really helps me out. Thanks again, and we'll see you next time.
Now we are going to have a little true or false session to test your knowledge on the tips, tricks, and facts about fall prevention. True or false, falling is normal as you get older. False, falling isn't normal with age. Staying on top of your medications, vision checks, and exercise as you get older will help prevent falls. True or false? The bathroom is not an increased fall risk. False. Falling in the bathroom is common. Using rubber-backed bath mats and being cautious where the ground is wet will help reduce the risk of falling. True or false? Poor lighting is a common cause for falling. True. Using a nightlight in the bathroom, hallways, bedrooms, and areas with low lighting can decrease your risk of falls. True or false? 1 in 8 adults fall every year in the US. False. 1 in 4 adults fall every year in the US. True or false? Staying active and social will not increase my fall risk. True. Physical and social activities allow you to stay independent and overall healthy. Staying active also helps maintain strength, endurance, and balance, which helps with strength and flexibility.
Great job completing the true and false section of our presentation. Falls are not normal and can be extremely dangerous. They are the leading cause of death and injury in older adults. In order to prevent falls, do your best to take today's tips in making your home as organized, clutter-free, and as safe as possible. The exercises we went over can help you to strengthen your muscles as well as help your balance and endurance. Finally, always remember to use safe practice when walking with a walker or cane or any other medical equipment. This concludes today's information on fall prevention and fall recovery. Shown on the screen are our references used for this presentation should you want to further your own research on the topics provided. Thank you for your time and participation.